That is the reason that people, when they actually want care, living in Cuba, living in Canada, living in the United States, when even their private insurance that they're forced to buy doesn't cover, that's why they come to the United States, because we're the leaders.
Hey, I heard you mention a lot of things about socialism.
Yes.
So I'm for more of a mixed economy, and I am for Medicare for all. I believe.
Doesn't that seems awful? It seems like you want to become an old person. Why do you want to become an old person?
No,
why do you want to use old ideas like socialism?
No, that's giving everyone the right to health care, health insurance. And right now, our current system, we have 600,000 bankruptcies. People file for bankruptcy under our current system. Our current system is not cost effective. It cost,
I agree.
What was it, $33 trillion over a 10-year period from right now. And a recent study by the Mercatus Center actually found that the Medicare for All system in the Senate would save $2.1 trillion over a 10-year period from 2022 to 2031. So why can't you get behind that?
Well, when we were talking about the costs of these systems, one has to be very careful. I was promised certain costs for Obamacare, and there was a lot of fuzzy math because the taxes kicked in early and the benefits didn't kick in quite so early. So the question is twofold. One, you're asking economically, you're saying that the current healthcare regime is not efficient, and therefore the socialist regime would be more efficient. That may actually be the case. That's not an argument for socialism, though. That's an argument for liberalization. That's for liberalizing the markets, making prices much more apparent to both the consumers and the service providers, to opening up what are now virtual monopolies for health insurance companies. And fortunately, by the way, this administration, it has around the edges worked on all of those things. There is also a moral argument as well, which is that people ought to be free, man ought to be free, and if healthcare is going to have to be rationed, I would rather it be rationed by me and my freedom of choice than by some bureaucratic board somewhere in the federal government. We see, to take, forgetting all of the other problems of socialist healthcare, let's look at the example of little Charlie Gard in the United Kingdom, where—
That's anecdotal.
That anecdote has happened several times over the last few years, but it illustrates my point,
Tens of thousands of people die every year in the U.S. because they lack health insurance.
Sure. I think many people around the world have died and been waiting on lines in socialist and communist regimes. So I don't think it's good to compare those numbers. The point that I will make, however, is that in countries, even mixed economies, even countries with relatively free socialist healthcare regimes, the government has the final say on what you can do, how you can treat yourself, how you can treat your children. When the Pope, when the head of the Catholic Church says, I will invite this baby into my country to receive health care, and the government has the right to say, absolutely not, we control your child. That's horrifically immoral, and we cannot allow that to happen here. Because, by the way, I'll also point out, when we speak about the efficiency of socialist healthcare regimes around the world, all of those regimes rely on the innovativeness of the American healthcare system, which leads the world and always has. It's true. You're shaking your head, but it's true. And so if the United States stops leading the way in healthcare, you're going to see that affect global markets and global healthcare regimes all around the world, and it'll be a very bad thing. And that is the reason that people, when they actually want care, living in Cuba, living in Canada, living in the United States, when even their private insurance that they're forced to buy doesn't cover, that's why they come to the United States, because we're the leaders.
We already ration care by the size of our wallets.
We ought to ration care by the size of our wallets?
We already ration our care by the size of our wallets.
Of course we don't. We have a robust social safety net. We have Medicare and Medicaid. We have a very generous social safety net, and nobody dies. I mean, it's one of the most absurd lies of people pushing socialist healthcare that people are dying in the streets. That's absurd. Anybody can walk into an emergency room. Nobody is dying in the streets in the United States and hasn't in the modern era.
Tens of thousands of people are dying in the U.S.
You can keep repeating your lie, but it doesn't make it true. Show me the person who is denied entrance to an emergency room, my friend. Show me the person. I haven't seen them.
Hey, I'm for facts over feelings.
You can repeat good slogans as well as bad slogans, but they remain slogans nonetheless. And I'm explaining to you the way the healthcare regime actually works.